So many good news coming. Pupils and students are gearing up to get back to schools. Curfew has been further relaxed from 12 a.m. to 4 a.m. daily. International flight operations are resuming on the 5th of September, and Nigeria is now on the third phase of the ease of COVID-19 lockdown. Are there still reasons to worry over continued spread of the virus? Well, on that note, I welcome you to another edition of COVID-19 Digest. I am Ogom Ezedimbo. On the program today, we shall be bringing you a situation report on COVID-19 response in Nigeria. Our interview session focus will be on Public Transporters Owners Association, the challenges they encountered during and after the interstate restrictions and way forward. And don't forget, our Global Update segment is on today's agenda. Please stay with us. I'll be right back after this break. We begin with the update on COVID-19. As of Thursday, Nigeria has recorded a total of 54,588 cases, an addition of 125 new cases, and 42,627 have been discharged, and 1,048 deaths recorded. Now, the global response has continued to witness huge deployment of resources and collaborative efforts to combat the pandemic. And notwithstanding all of this, the global confirmed cases have exceeded 25 million. And since hitting the 15 million mark, numbers have been increasing by 1 million cases every 3 to 4 days. The countries that top the global disease burden include United States with over 6 million, Brazil almost 4 million, India almost 4 million, and Russia above 1 million cases of COVID-19. In Africa, South Africa still has the highest number of cases, but has fallen from the 5th to the 6th position in the world. In Ethiopia, reports say the numbers have been on the increase. The Nigerian Secretary to the government of the Federation, Boss Mustafa, recently highlighted some challenges hampering the fight against COVID-19 in the country and government's response. And so far, let's take a listen.
As of 28th August 2020, like I have said in my previous briefings, a total of 173 candidate vaccines were under evaluation. 33 candidate vaccines are under clinical evaluation. 8 are in the phase 3 trials, while 143 candidate vaccines are in the preclinical evaluation. The Presidential Task Force would continue to monitor developments so that the country can benefit from the emergence of an effective vaccine. There is a politics to this. We would coordinate and work with the World Health Organization and other multilateral agencies to ensure that there is an equitable distribution of vaccines when they show up. The cumulative test positivity ratio, TPR, which shows how many % of our total tests are positive, has reduced from 15.2% at the end of July to 13.3% at the end of August. There are tables, when you get my statement, that illustrate the situation of the CFR and the TPR. The accomplishments recorded through the national response in the period under review include the following. 1, Nigeria now has 68 laboratories in the COVID-19 network, spread across 34 states and the Federal Capital Territory. The remaining 2 states, Kebbi and Niger, are in the pipeline for coverage in the next few weeks. The PTF has strengthened collaboration with all the states in the country to maintain one national response to address the pandemic. This has been driven by joint work between the PTF and the subcommittee of the National Economic Council chaired by the Governor of Delta State, Dr. Ifeanyi Okowa. 3, the number of cumulative samples tested has exceeded 400,000 plus. 4, increased risk communication through collaboration with community leaders and partners. And 5, we've improved synergy and collaboration.
I will now take a break. When we return, our interview session will be next.
Debunking COVID-19 myths. 5G network causes COVID-19. This is not true, as viruses cannot travel on radio waves or mobile networks. Consumption of alcohol prevents COVID-19. The alcohol consumed will not remain in the linings of the nose, mouth, and eyes, so do not have the potential to stop an infection. Spraying alcohol or chlorine all over the body kills the virus. Doing this will not kill viruses that have already entered your body, rather, they can be harmful to mucous membranes. COVID-19 affects only old people. This is not true. People of all ages can be infected by the virus. Antibiotics and chloroquine prevent and treat coronavirus. Antibiotics do not work against viruses. There is no specific medicine recommended to prevent or treat COVID-19. The viruses die after 4 minutes on surfaces. The viruses have been proven by sufficient research to last hours or days on some surfaces with suitable conditions. Mosquitoes can transmit coronavirus. COVID-19 is a respiratory virus and cannot be transmitted through insect bite. Coronavirus cannot survive the African climate. This is not true. The virus can be transmitted to all areas. Drinking hot pepper soup can kill coronavirus. This is not true. There is no evidence that it kills this virus.
When government imposed a total lockdown of interstate movement, one sector that felt the heat then was the transport sector. Employees of various transport companies and their families were obviously at the receiving end. But to cushion the effect of this subsector, the Ministry of State for Transportation approved a sum of 10 billion naira to support as a form of palliative for them. Now we have a chat with the president of the association to discuss the ups and downs of the period and way forward. Joining me now on the program, COVID-19 Digest, is a National President, Public Transportation Owners of Nigeria Association, Engineer Isaac Uhunmwagho. Welcome to the program, sir.
Thank you very much. Good afternoon.
Yeah, let's begin first of all to know what category of public transporters make up your association.
The category of public transporters are all the transport companies that you can identify on the road. All the major transport companies that you see their branded names, the names of their companies on their vehicles, they are all members of Public Transport Owners of Nigeria Association, PTONA, all of them.
During the lockdown, I understand restrictions were on, no vehicular movement. How did your members survive this period?
We were locked down. We understood what the situation was. We knew that the problem of COVID-19 was serious enough and demanded measures by governments all over the world to contain, the spread of the coronavirus. So we just packed our vehicles, and during the lockdown, we could not even come and warm our vehicles or maintain them so that they do not develop problems. It was only after the lockdown that we were able to start paying attention to our vehicles, but we were not allowed to move during the ban on interstate transportation. I think that one took another 2.5 months or close to 3 months.
Now, apart from your vehicle, in terms of family life and all that, how hard did COVID-19 hit members of your association?
It does not come harder than we experienced. Nothing comes harder than what we experienced. Businesses were not open. Our workers remained without work some limited activity. It was zero activity. And it was bad physically, psychologically, and financially on our businesses, on our companies, and especially on our workers.
Your association paid a courtesy visit to the Ministry of Transportation lately. Now, the difficulties you highlighted during the COVID, what your members experienced, did they inform your visit to the ministry?
Yes, they were part of the reasons that we visited the Ministry of Transportation. They were part of the reason. It was not primarily because of that. We had made arrangements for quite some time, for our association to pay a courtesy call onto the Honorable Minister of State for Transportation. It couldn't happen until about 2 weeks ago. So obviously we discussed all aspects of issues that affect Nigerians who are traveling or attempting to travel around the country. We discussed many of the issues, not for the first time, but because we have always maintained dialogue with the federal ministry since the beginning of this year especially. So one of the things we discussed maybe extensively was the effect of COVID-19 on the members of our association and the Nigerians traveling on the road.
Now, when you say Nigerian challenge on the road, what exactly are you talking about?
There are lots of problems affecting public transportation in Nigeria, a lot of problems. And we listed out many of them. Apart from the effect of COVID-19 and the devastation that it did to us and to our business and our workers, there are fundamentally a lot of flaws, a lot of challenges with road transportation in this country, especially in the last few decades, maybe in the last 20 to 30 years. Road transportation, I do not know if you travel by road. Road transportation is no fun in Nigeria. It's no joy to travel on Nigerian roads in recent years. Even where the roads are good, relatively good, there are so many challenges, obstacles, impediments, obstructions that make the journey not to be a smooth journey anymore. All these issues adversely affect our industry, adversely. And we discussed a lot of them at length with the Minister of State for Transportation.
I understand that the Ministry of Transport promised to support your association with a sum of 10 billion naira. How far has it gone? Have you received any yet?
The Ministry of Transportation has not promised to support PTONA with $10 billion. Please,
Naira, 10 billion naira.
10 billion naira.
Yes.
The Ministry of Transportation has not promised to support PTONA with 10 billion naira.
Okay.
What has happened is that the federal government of Nigeria has approved the sum of 10 billion naira for the entire transport sector, the entire road transport sector, to assist, in alleviating the hardships associated with COVID-19, the hardships associated with the lockdown, and then the hardships that also accompanied the ban on interstate transportation. In addition to that, we are not operating normal services even up to this moment. while, maybe within the cities, many Nigerians are saying that vehicles are now loading full and not adhering to social distancing measures, which specify that vehicles should be about 50%, in capacity, should be full up to 50% capacity. We in PTONA, because we are organized and because we are working 100% with what government, dictates, we are working under the limitations of social distancing. So you find that our vehicles are carrying partial load, 50% load, as specified by the NCDC and PTF. So we are not really operating profitable businesses, especially when many others in the transportation sector are no longer adhering to the guidelines of 50% full capacity. So the palliative of 10 billion naira we envisage is supposed to aid those of us who felt the brunt of the lockdown, who felt the brunt of the ban on interstate movements, and who are still feeling the brunt of social distancing operations in our businesses. So it's a threefold effect of hardships that we in PTONA are facing. I hope I am still audible to you.
Yes, I'm concerned about the sharing formula. How do you intend to share this money among your members?
The sharing formula?
Yes.
We are not the ones to share the money.
Okay.
It is the Ministry of Transportation, maybe in conjunction with some other agencies of the federal government that will share the money, to various sectors of the transport sector, various sections of the transport sector.
Okay.
The money is not coming totally to PTONA. No, okay. Please, we are not. It is the ministry. The ministry, they have not specified to us yet, because there are some other sectors. Although many of the other sectors, like the tankers, they were not affected with any lockdown. They were not affected by any ban on interstates. Like the trailers, they were not affected by the lockdown or the ban on interstates. But maybe there are ways or there are aspects of their businesses that were hindered. Maybe there are. And I think we believe that the Federal Ministry of Transportation is going to take into consideration, the effects of the COVID-19 measures and hardships on all of us. So we do not know what proportion of whatever federal government has approved will come to PTONA. Also, obviously, there are, general motor parks that do not, you asked me before, that operate vehicles that are not branded. We know that the effects might not have been as much because, they were able to have some of their businesses going on somehow.
COVID-19 is real. COVID-19 is with us. What is the situation in our motor parks as regards stopping the spread of COVID-19? What measures are you putting in place?
We have put in place measures since the 1st of July, when the ban on interstate movement was lifted on us. Between our companies, the Federal Ministry of Transportation, NCDC, and the PTF, comprehensive guidelines and protocols were established which included provision of various facilities, hand washing facilities, at our terminals. A lot of these they are very much in place, and they have actually become part of us. We have operated under these conditions now for 2 months, and they have become part of us, and we are still operating with social distancing in our vehicles.
All right, thank you very much, Engineer Isaac Uhunmwagho. He is the National President, Public Transportation Owners of Nigeria Association. Thank you very much for being a part of the program today.
Thank you so much. Our association is Public Transport Owners of Nigeria Association, PTONA.
Let's now see what's happening in some countries around the world in the fight against COVID-19. It is the Global Update.
Africa's Center for Disease Control Chief John Nkeng has urged global participation in an initiative to fairly distribute vaccines against the new coronavirus. While answering questions from journalists at an event, the Africa CDC chief said it will be catastrophic for Africa and the world if the situation was repeated when the continent had to wait years before therapies that had been deployed elsewhere became available.
We are in this together. No country will be safe if any other country in the world still has cases of COVID. So it's in the interest of the whole world for us as we deal with this generational crisis.
By pulling together not only the demand, but also to pull together the buying power of a member. This is a global initiative. And from the African continent in particular, as we have heard from Honorable Minister, high income and middle income countries have agreed to self finance the vaccines.
COVAX aims to procure and deliver 2 billion doses of approved vaccines by the end of 2021 and currently has 9 vaccine candidates in its portfolio. On Thursday, the CDC reported that new cases of COVID-19 had fallen in Africa by 11% over the past 4 weeks, and that recovery stood at 80%. But Nkeng warned that it's too early for the continent to declare victory against the pandemic. White House spokeswoman Kale McEnany said there is no political pressure on the U.S. drugs regulator to quickly approve a vaccine for the deadly coronavirus disease after drug makers and the Centers for Disease Control suggested one could be ready just ahead of the November presidential election.
This president wants to break through regulatory barriers to get a vaccine as safely to the American people as quickly as possible because lives are at stake.
The White House also said it expects Congress to approve the legislation needed to avoid a government shutdown at the end of the month when current spending bills expire. Police in Nepal used tear gas and a water cannon to break up religious rally that defied a government ban on public gatherings imposed to fight the coronavirus pandemic. Despite the ban, about 2,000 residents poured into a major thoroughfare of Lalitpur near Nepal's capital, Kathmandu, to pull a chariot of the rain god Ratu Makindranath, a ritual that has been celebrated for countless generations. Authorities imposed temporary curbs in Kathmandu and surrounding areas in August to help contain coronavirus contagion and asked residents to observe festivals at home. Witnesses said the protesters wearing protective face masks against the virus threw rocks at baton-wielding police motorcycle on fire. An injured person was carried away by police, according to them. Narayan Prasad Bhatta, the top civil servant of Lalitpur district, said the rally, like all other religious and social gatherings, had been banned to stem the spread of coronavirus. But participants said they must be allowed to carry on with the rain god tradition that had been celebrated for centuries. Bogota restaurants reopened its dining halls this week as the government relaxed one of the last major coronavirus constraints after businesses suffered from a 5-month lockdown. Nevertheless, while restaurants are able to open, they can only operate at 25% capacity. At the end of August 27, Bogota eased coronavirus restrictions over the city after authorities announced infections have stabilized. A strict quarantine that had been in force since March 25 is being phased out in the capital.
In its place, a new operating hours in Bogota for different sectors of the economy so as to limit face-to-face interactions in the city of 7.4 million people. However, local authorities warned that the pandemic is not yet over and urged citizens to exercise common sense. Outside Bogota, regions whose health sectors have struggled to cope with the pandemic will still have some lockdown measures in place. The easing of quarantine measures is a relief for local businesses and workers who complained they were doing it tough under a strict lockdown. Colombia's central bank has said the domestic economy is set to contract between 6% and 10% this year, with a shrinking of 8.5% as the most likely scenario.
And that's our package today. Thanks for being a part of it. Continue to stay safe and protect people around you by observing all the measures prescribed by health practitioners aimed at keeping COVID-19 at bay. I'm Ogom Ezedimbo.